Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hardworking Americans and their families? You will. This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefit in benefit plan. Now prepare to learn, plan, save, and protect with the FIA Group.
Welcome to another episode of Empowering Plans. My name is Kelly Dempsey. I'm the Vice President of our consulting department here at FIA. And along with me today, I have Kevin Brady, who is another attorney in our consulting department. Say hello, Kevin.
Hello, Kelly.
So today we've got another interesting topic. I know the last couple podcasts, there's been some discussion about the COVID-19 vaccine and back to work requirements and coverage of the vaccine. But Kevin and I kind of want to take a step back and go back to the concept of COVID-19 testing and really kind of dig into the concepts of this unanticipated costs of the COVID-19 testing and how it has developed and changed over, the last year or so, because things are quite different now. So the testing is tied to the public health emergency. HHS, the Health and Human Services, declares the public health emergency. And in case you missed it, they did actually extend the public health emergency from April through July 20th of 2021. So it generally gets re-extended for another 90 days or so. So at this point, the rules related to testing are that group health plans must cover the testing without cost sharing, pre-authorization requirements, or other medical management requirements for COVID-19 testing. Originally, way back when this started a little over a year ago, the tests were all very new. The testing was new and there wasn't anything that was specifically approved by the FDA. So there was emergency approval, and now we actually have a lot more FDA-approved tests. The tests have obviously continued to evolve over time, which, no surprise, that's how the medical world works. So there are different things, and now recently there's been approved some at-home testing material. So that is an interesting development. But as time has gone on, the rules related to testing are specifically that the health plan has to pay the posted price listed by the provider on their website, or a negotiated rate if they have managed to negotiate a rate. So that's an interesting piece to this, is that providers essentially are being able to dictate the pricing. And I know that Kevin has been reading some articles out there and he's got a lot to say about this. So I'm going to kick it over to Kevin to talk a little bit about, where we're at right now and what we're seeing from a testing perspective and the costs of these tests.
Right. Yeah. Thanks, Kelly. So exactly like she said, the result of the CARES Act and the requirements on health plans is that they have to pay either, a negotiated rate or just the posted cash price when no negotiated rate exists. And, that's pretty vague. That's not a super specific thing. It's not putting limitations on what the provider can require or anything like that. So you can post a cash price on your website, and that's going to pretty much dictate what rate is going to be required. So if I'm a health provider and I put something out there on the website, I don't know if it's going to be, $1, $1 million, whatever it might be. There's really nothing that's going to be limiting that rate on the website. And, what's the result of that been? What have providers been doing? Looking at reports from Kaiser Health, for example, hospitals, large health systems, and freestanding emergency rooms have been charging prices up to almost $1,000 for, the molecular COVID-19 tests. And those tests usually cost about $50 to $100 or less to run. So, thinking about that, health plans are going to have to pay the price that gets charged or whatever's posted on the website. It's not going to be, what the actual cost to run the test is. Thinking about that and then coupling it with the fact that there's been as many as 400 million tests administered in the U.S. today, providers are pretty much raking in the dough from doing these tests. Another thing to think about is that, here at the FIA Group, we talk about being consumers of healthcare. And the idea behind the CARES Act and the testing mandate is that, anybody that wants to go and get a COVID-19 test can go and do it, and they're not going to have to worry about the cost that they're going to have to pay. And that's obviously important, right? Like, we want everybody to have the ability to go and get a test, and we don't want people to, not go get a test just because they don't know how much it's going to cost them. And that's definitely good news. But, I don't think many people out there are thinking about how much it's going to cost their health plan to go get a test. For me, for example, early on in the pandemic, trying to, wade through the waters and understand what was going on with the pandemic and everything like that. So I'm a bit of a hypochondriac, I don't know, but early on, I thought I might have been feeling some of the symptoms, and, I was desperate for a test. The last thing that I was thinking about is, how much is this going to cost my health plan or anything like that. So I haven't gone back and crunched the numbers and checked or anything, but, it could be, according to these rules, exorbitantly high. And I think one other thing to note about testing in COVID specifically It's just been interesting to see the change in logistics and how easy it is to get a test now versus at the beginning. So for me, I live in Chicago downtown. And like I said, early in the pandemic, I was feeling like I might have symptoms and I wanted to get a test. And for me, it took 4.5 hours of calling around, searching, trying to get an appointment at, a PCP or something like that. And nobody had tests available. And eventually, I found Physicians Immediate Care or something like that. I don't remember the name of the exact provider, but I finally was able to find a place. And, that was the first place I signed up. I wasn't, doing any cost comparison or anything like that. Not to say anybody should, but I was just relieved to finally have the ability to get tested. And, now a couple of weeks ago, just for travel purposes or anything like that, going through the same process, I was able to, download an app on my phone, and I was able to find a provider within, I would say, 10 minutes. And once I got there, the process was streamlined there as well. But really, just thinking about it in total and the impact that these high costs for these tests have, it's great that patients aren't seeing, co-pays or deductibles or anything like that being impacted by this. But I do think that there is going to be potentially an impact on, higher premiums for people on the back end. So yeah, we're not going to see those upfront costs that might be associated typically. But given the fact that the health plans are required to pay so much and it's not really regulated in any way, that's really kind of putting health plans in a bit of a pickle. So, I know Kelly has a little bit more to say there on how health plans are dealing with that.
Yeah, thanks, Kevin. It is very interesting because when so much of the world depends on your negotiating skills and things of that nature, health plans don't necessarily have the leverage in some cases. They'll be looking to their administrators and even those local hospital systems to try to work with them as local employers to cut a deal. So there's definitely a lot of chatter out there about what the hospitals and whatnot are doing right now. It's pretty predatory and it's price gouging. This isn't anything new, not necessarily unexpected. Unfortunately, we do see this a lot. And I think we'll be diving into this on one of the upcoming FIA webinars in a couple weeks. So stay tuned for that if you're interested in kind of diving into this and hearing a little more. But, right now, unfortunately, our hands are kind of tied with the rules are the rules. The rules say that the health plan must pay that cash price is listed on the website or negotiate something. So, we haven't really heard a whole lot of chatter regarding what health plans are doing with respect to whether or not they've been able to negotiate. But again, sometimes negotiating with these different types of entities really depends on the leverage that you have, how many employees you have on your health plan, how many tests they think they're going to need to run. And, the interesting piece to the rules is that while, the group health plan doesn't have to cover the requirement of the return to work testing. So if an employer says that they're requiring testing to come back to work, which we know is a hot topic, and Phil and Brady talked about that a little bit. But that concept of returning to work is that the only time the health plan has to cover it is when it's medically necessary. So for example, in situations where an individual's job regularly exposes them to an increased risk of contracting COVID-19. So your first responders, people in the medical field, things of that nature, that's where it's going to have to be paid for by a health plan, which is where it comes down to, what kind of decisions do the health plans need to make? Do the employers need to have conversations with their employees about being better consumers? I mean, if you've heard Adam Russo, our CEO, talk, that we use our own health plan kind of as a guinea pig to test out new cost containment opportunities in the industry. Adam talks to us at every single staff meeting about how to save our health plan money. And that's why we've been able to do some of the things we've done with our health plan, is because we've made all of our employees smarter consumers. So there is a dynamic, I think, that health plans will just have to focus on where they're at in the industry, where they're at geographically, what are the providers that are offering testing, and try to figure out where to steer their participants to know that they'll be going to a provider that is hopefully not costing the health plan an exorbitant amount of money. It's funny, Kevin and I are two of the remote employees at FIA, so we're not in the Massachusetts area seeing what's happening there, but Kevin obviously has his own experience being in Chicago, Illinois, and trying to get testing out there. And I myself am in Ohio, and while I haven't necessarily had to get tested, knock on wood, thankfully, I do have friends and family that have had to try to go get tested. And several months ago, it was still hard to try to find a test that was cost effective, especially for individuals that don't have any type of health coverage. Trying to find a test was difficult. And it will be interesting to see where testing goes from statistics wise, because obviously our testing is progressing and developing, But on top of that, there's still a lot of conversation regarding the vaccine and the acceptance of the vaccine. And so the need for testing is still going to be there, even, in the near future and potentially a year or two down the road, especially as this virus continues to potentially mutate. So while we're focused on the vaccine piece of it, there's still a lot to talk about with the testing and how that may potentially change, especially if and when the public health emergency is eventually determined to come to an end. So, it's just a very different world that we live in. It's constantly evolving and changing. And I know that all of you that listen to us probably get tired of hearing us say that on a regular basis. But overall, things are going to keep developing. The data is going to keep piling up now that we have, a year or so more of testing under our belts. And the number of tests I don't think will go down anytime soon. So there's definitely still going to be growing pains as the data increases and as we advance medically. And if this virus keeps mutating, making sure that the testing and the vaccines obviously catch the new variations and forms of the virus as it grows. So it's definitely an interesting subject, and I'm sure, unfortunately, it will not be the last we hear about it. But with that said, we won't take up any more of your time today on this podcast. We'll wrap it up and just say that, this is something to continue paying attention to, because the rules, like anything else, can continue changing as things continue to develop and evolve. So thank you very much for joining us today, and we hope you listen to our next episode. Thank you.
Thank you.